Welcome to Quad A Now, where we explore the world of patient safety, the impact of accreditation, and other topics relevant to outpatient healthcare facilities and dental practices. Join us as we explore diverse topics, share success stories, and navigate the challenges that define the pursuit of excellence in patient safety.
Welcome to the Quad A Now podcast. I'm your host, Tom Terranova, CEO of Quad A. Today, we're diving into a topic that matters to every accredited facility: how to move beyond a check-the-box approach to safety and make compliance part of your daily operations, not just something you scramble to prepare for every few years. Joining me today are two people who work on the front lines of this challenge every day: Debbi and Rick Conn from Universal Healthcare Consulting. UHC is listed on our website as one of the consultants available to provide services to facilities undergoing accreditation. Their organization has assisted well over 100 facilities through the Quad A accreditation process, and they bring decades of experience helping facilities strengthen compliance, reduce risk, and create cultures where accreditation becomes second nature. Debbi also volunteers on our standards committee, providing expertise and a business perspective. Debbi, Rick, welcome to the show. Before we jump in, can you each share a little bit about your background and the work you do with clients at UHC?
Sure. I'm Debbi Conn. My background is I am an RN, I'm a healthcare risk manager. I have been a nurse since 1985, been a long time. Started in compliance and office surgery back in 1990, before everything, all the rules and regulations were really coming out strong. Worked in an office-based surgical setting and realized that the need for compliance was there. And facilities didn't know what they didn't know. So became really involved with both the accreditation body and learning a lot about Quad A and the need for compliance. Rick and I opened Universal Healthcare Consulting in 2001, addressing both office surgery and ASC for compliance in the outpatient arena. And we have worked with many clients, and we are now based out of 30 states and even have a Quad A accredited facility in Bermuda with a second one to come.
Thanks, Tom, and thanks for having us this morning. We really appreciate it. My name is Eric Conn. You can call me Rick, you can call me Ricky, you can call me Eric. It doesn't matter. We went through that before, but so my background is actually I'm a physical therapist. I used to own my own physical therapy centers, and then way back when I sold them off, and I started working with Deb in creating Universal Healthcare Consulting. And the challenge at the time was how to make it scalable. And that's what we've been able to do. And we've been enabling to make our company more scalable. It's also allowed facilities that are under contract with us, as you were saying earlier, to become compliant daily, not just, once every 2 or 3 years or when there's an inspection. It's something that becomes innate in what they do.
Thank you both. And thanks again for making the time to be here. I know we have a lot of back and forth because of the sheer volume of facilities that we work with, that you guys consult with. So, we have ongoing conversations all the time with our staff, with various parts of the team. So this is a really good opportunity to kind of bring some of the insights, some of the pieces of our conversations really out to facilities that are accredited, facilities that are pursuing accreditation for the first time or considering accreditation, especially if you're in a facility or that's in a state that doesn't have an accreditation mandate. That's a completely different conversation to have. Like, what's the value that this brings to me? And really, my sincere hope is that more and more this podcast and a lot of the content we talk about reaches patients. So patients understand really what the value of this process is to their care, to their experience with a physician, with a surgery center, with an office-based practice, whatever it is, to say, well, this is an important decision that I'm making in terms of choosing my provider. They also need to be making an important decision about their safety and their quality. And so I'm hoping that we reach not just facilities, but sometimes as you're thinking through what we're talking about, in the context of what a patient should be thinking. So, Rick, you started with sort of this daily concept, and that's the basics, right? So let's start there. When we talk about year-round compliance, what are the daily habits and operational practices that a facility can do that make the biggest difference in staying survey ready at all times? And the question's for either or both of you, so feel free to start where you do.
I'm going to start with this one, okay? Because it starts with the basics of creating the habits that meet the standards and follow all the manufacturer's IFUs and not falling into somebody else's bad habits. Like you said, Tom, we have the same mission statement that you do. It's all about patient safety. So one of the worst things that we hear is this is the way the person before me was doing it. So setting a compliant and stable routine, it may be overwhelming at first, but it becomes natural and very fast. And we help our clients creating this compliant environment through the use of our UH cloud and along with our consultants, our risk managers.
So basically, Tom, how we believe how you do anything is how you do everything. So year-round compliance starts with building an efficient daily workflow where every task is done in a way that meets the regulatory standards. We've always told everybody there's countless ways to do a certain task. You might as well do it the one way that meets regulatory compliance instead of not doing it that way. And that will help create a better routine. So when it comes to compliance, it's built on everyday processes. It keeps you survey ready. It makes your job duties clear and easier to follow. It actually will boost employee satisfaction and morale. It'll reduce turnover. And what does all of that do? It ultimately will create a positive, well-run environment that leads to something we all want: better patient outcomes and higher patient satisfaction. And that's really the important thing. So when a facility is consistently following the regulatory standards that exist for good reason, the staff can focus fully on the patient care and small mistakes are avoided, nothing slips through the cracks, and you're never scrambling to fix an issue when after it's too late.
That's really, I think, the key, right? And I think what's interesting to me always is I think we as people, maybe it's our educational system, maybe it's us, that we're built to sort of not want to cheat. So, right, there's a million ways to do something. So we think, well, I have to come up with my way, or I have to come up with my own way. And it feels almost dirty and like cheating to take something that's already been used. But, to take your example, I mean, you all work in 30 states and over,
Mhm.
hundreds of facilities with a team. So you can bring that expertise and leverage expertise and say, well, you can do it your way. You can create a way, but go to the well and get the water. Here it is, and here's how it works, and here's how we know it's compliant. So, obviously facilities can do this on their own, but some facilities out there may be struggling. So how does a consultant, a good consultant, and specifically, you guys, how do you help a facility shift from being survey ready to being patient ready, right? That's my big message lately, right?
Right.
Lean into being compliant for grandma tomorrow morning, not for the surveyor in 2 years.
Yeah. So basically, the whole idea is if you're just survey ready, that means the rest of the year you're not, or you don't know if you are. And that's not conducive to good patient care. So a well-run office, everybody knows exactly what needs to be done. One of the things I tell my new clients is this: when you get on a plane, before you got on that plane, there was a checklist. And that checklist, every single item on that checklist had to be checked off. Now, if you heard the pilot go, you don't need to check the wings, they're fine. They were flapping before, they're flapping now, they're good. Or you don't need to check this or check that, it's okay. In other words, cutting corners, that's not something. I paid good money to go on that plane, and I want to take off safely and I want to land safely. The same thing with the patients. They deserve it. And they should be able to get that. You go through every single item on the checklist because it's important, whether it be checking your OR and the environment, doing the patient pre-op, any function that needs to be done to ensure that that's a safe environment for the patient needs to be followed. And if you do that on a daily basis, then you're always compliant with rules and regulations, and you're never chasing your tail at the end of the day or when surveys are coming, trying to figure out, am I compliant, am I not compliant?
And it's starting with good habits, and it's starting with understanding the reason behind what you're doing. If you understand that there's a reason for the standards, then you can understand why you're going to practice the way you're practicing. And I think that that's a lot of it. A lot of what we explain, a lot of what my participation in the standards committee helped is that these standards are very applicable and they make sense. And we now have interpretive guidelines to understand how to follow the standards and why they make sense. So being able to implement those on a regular, ongoing basis will give you the understanding. And it's also the protection. You don't want to be doing things wrong because, like we know, it's not bad until it's bad. And then when it's bad, it's really bad.
It's really, yeah, it's terrible. What you said there is really powerful too, because I find when a facility is the most incredulous or has the biggest challenge with a set of standards or with a program entirely, it's because of one of two reasons. They don't think the standard's important. They don't realize it's why it's there, or they think it's so basic that it shouldn't be a challenge for anybody. And the reality is, most of these standards, just like many laws, are not written in a vacuum. They're written because someone's gone completely off the deep end and done things that most good practitioners think are unconscionable. And so you're trying to protect and guard against that. And it's sort of like, I guess it's sort of like therapy. You kind of talk about accepting it. Sort of acceptance is the first step, right? If you sit back and you think, well, these standards were written because somewhere nearby, one of my colleagues went off the rails and did this thing wrong. Now my focus is not about fighting whether or not it should exist. It's about staying compliant and maintaining that discipline
Right.
so that I'm not that cautionary tale for somebody else.
Right. Don't want it to happen to me.
Yeah, right, right. So having said all that, leaders are obviously critical in this. Otherwise, sustainable compliance just doesn't happen because it's a culture shift. So, what does leadership buy-in look like in a high-performing facility that may not be in a kind of a run-of-the-mill facility or a low-performing facility? And how does it impact the staff, that the people providing the daily kind of patient care?
Everything starts from the top. With strong leadership, you foster a strong and dedicated team. When the owner, the medical director, when they have the respect and they value compliance, then they create the culture of the organization. Open communication, active discussions, all encourages staff to participate and feel empowered. Everybody needs to feel empowered in quality improvement. You never know who's going to bring the next best idea to the table. And
Exactly.
being able to listen to them.
Right. And I'd like to also add that leadership buy-in isn't just about saying compliance matters. It's about modeling it every single day. When leaders consistently follow the same rules and standards they expect from their staff, it sends a powerful message. Compliance isn't optional, and it's not just for you to do. It's for everyone. One of the examples Deb and I were talking about is, like I used to work retail as a kid, and you'd see a piece of paper on the floor, and the manager would walk by and go, "Pick that up." And it's like, yeah, I went and picked it up, but the manager needs to pick it up. The other evening, I got a phone call from a client who one of the employees was having trouble with the credentialing module. I didn't tell them to call support. I handled the problem. I showed. So you have to lead by example is really what it comes down to. And that's really important.
And it empowers your team.
Yeah. Well, I think that's true. I mean, that's true of any organization. And I wonder sometimes how much practices, especially smaller practices, see themselves as an organization rather than as an extension of their own personality. Not for any fault, but it's easy to build a habit based on, this is my practice, this is how I practice as a physician, it's my personality, it's my skill, and it becomes an extension of me. I mean, we even refer to a lot of different types of healthcare professionals as extenders, right? And so to think intentionally about building an organizational model, I think is a mental shift that I don't know that a lot of people in leadership in smaller practices, particularly, I don't know that switch always gets flipped. And you talk about leading by example, and you talk about being a good leader, and the other side of that is the staff. So you guys are in hundreds of facilities. What's the practical, like, paint by numbers 1, 2, 3 tactics for frontline staff to assume ownership and show that kind of entrepreneurial spirit and say, this part of the kingdom, this is mine, I own it, I'm going to make sure I'm doing it the best I can, and it's not someone else's problem, it's not the doctor's problem because it's his or her practice.
Right. So in that type of scenario, which is also what we try to do within our organization, you have to be involved. Okay. It's not enough to tell somebody, hey, you need to make sure that you did, filled out all the logs this morning and made sure everything was done. You need to go and talk to them. Hey, were the logs done? So we document and check it. Let them know that there's going to be checks and balances. People need to know that, because if there's no checks and balances and nobody coming back to look and see if things are done, which is the responsibility of a business owner, of a manager, of an employer, to make sure that everything's being not just to be done, but done correctly. Then you're giving the guidance that they need. Then then I can rely on you. And I
Right.
know that you're going to be doing everything that needs to be done in the way it needs to be done. And you know that it's important to me because I took the time to guide you, to encourage you, to make sure that it was done. Do it with you, whatever it
Right.
takes.
The
That's what people
education,
exactly.
educating them and so when you're delegating, that you ensure that whatever you're delegating, the person's educated on how to complete it, that they understand their task, they understand the reason behind it, and that they're doing it properly. And like Rick said, the checks and balances. So upper management isn't going to look at necessarily the temperature and humidity in the OR, but they will check the log. And hey, the humidity was out of range this day. What did you do about it? Making sure people know how to deal with issues when they occur and how to approach upper management. I understand surgeons don't always like to be involved in the day to day minutia. But at the end of the day, after a long day, to see a surgeon help move that patient to PACU and let everybody get out of that surgery center in a timely manner really means a lot to the team as well. So it's the overall culture that does need to be created in any organization.
And I'd like to add something that, when you have the opposite that happens, when leadership, let's say the surgeon is not involved. I'm the surgeon. You guys take care of everything. You do what I tell you to do, but they don't follow up with it. It creates it creates poor morale in the facility. And then the biggest complaint that we hear is you'll always have an administrator who really does care about their job, but they're not getting the support when they tell the scrub tech, hey, you're not cleaning the OR correctly. I need you to do this, 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 and look in the corners or whatever. If they're not getting the support from the surgeon, it falls on deaf ears. And it just makes their life a little bit more difficult in trying to deal with that situation. So it really comes down to the whole culture comes down to everybody from the top down needs to buy into compliance.
And it relates back to a point that I think, Rick, that you said earlier is about staff turnover, right? And I think when you implement things that are about accountability and about checking back, and not accountability in a heavy-handed way, but saying like, is making it a dialogue, right? Making compliance a dialogue. I found, and I think there's a lot of literature on it, that yeah, your staff turnover is gonna reduce. You're gonna like stop losing your good staff, but when you make that transition, you're gonna have a lot of turnover because you're gonna lose the staff that really doesn't want to be checked up on. You're gonna lose the staff that maybe is not doing things accordingly. One of the big things I think, if you read just kind of management material in general, is that shift from sort of really loosey goosey to running a tighter ship, that shift towards a higher functioning organization. You'll have some turnover there, but once it gets there, that's the accelerant that makes you a high functioning organization, not just about compliance, but about functioning as a business, as an organization, and as a practice.
And those are employees you don't want as part of your facility,
Right.
right? I mean, that's the big thing. The person that's going to cut corners, no, I don't need you. I don't want corners cut. Yeah.
And when we're talking organizations, it can be the single plastic surgeon with one scrub tech and one nurse, or it can be the large multi OR, multi specialty facility that has 50, 60 people. They all need to run the same for compliance and working together as a team with good leadership.
Well, and if you think about it, right, if you're just from a percentage standpoint, if you have one kind of D student as your kind of lax person and you're a staff of 33% of your staff is not up to par and you're not going to be high functioning. It makes sense. I think it's sometimes we need to say the quiet part out loud, I think, especially for busy professionals that are not, that's not their main task. That's not their main focus. Their main focus is providing care. So all of this, we talk a lot about reactive compliance and shifting to proactive compliance. So in your opinion, from your experience, what would be the telltale sign of a facility if they were to look back and do the smell test? How do they know they're still reactive instead of moving proactively towards compliance and safety?
Well, biggest sign, of course, is when a facility struggles to be compliant immediately before a survey. They don't have regular staff or they don't have the quality meetings. They have issues that haven't been addressed and they're working backwards. We want people to always be working forwards and not working backwards. When they identify a problem, a plan of correction should always be implemented at that time and followed up. So we're able to help that with the cloud, with our technology and our risk manager behind it. We create a climate where the incidents are tracked and trended. QAPI is ongoing. Staff are encouraged to participate. Incidents are addressed when they occur. And the plan of correction is not only implemented, but it's maintained.
Yeah. And I'd like to add that a reactive facility is usually in constant catch-up mode. So you always see the last minute scrambling to update policies. They have piles and piles of incomplete documents. The staff, they're just not prepared for any type of inspection. And there's a lot of stress there's a lot of stress because you have to, fill the gaps that have been created over the last 2 years. So turning that around starts with weaving compliance into the daily rhythm of the facility. There's like a common theme in this podcast. compliant daily. It's just as easy as not being compliant. It truly is. It's about making quality checks, policy reviews, staff engagement part of every single week, not just every season or when there's a survey. With the right systems in place, like like good technology and a good risk manager actively involved, issues will get caught early and corrected quickly so that they don't resurface, so that you have a good copy program that actually works. And that's the difference between proactive and reactive.
Well, I just want to take that back real quick to culture because, I- you know, Debbie, you mentioned, copy meetings, issues are caught. Rick, you just said, issues will be identified, they'll be caught. And issues in and of itself is something that people don't want to deal with. They don't want to talk about. And I can go back to 10 years ago when I was running investigations for Quad A and I'd get, issues of something that came up, or I'd get a report of something that happened. And the board or the standards committee would say, well, they needed to have a red stop, or they needed to have where anybody on staff could have stopped the case at any time. And I remember distinctly having that conversation with the board member and saying, yes, that process is important to have a red stop so that, the lowest person on the totem pole can hit the stop button and stop the case. But are they going to pull the trigger? And that's a culture issue, right? Because
Yes.
if that person's afraid of being seen as a wet blanket or a problem because they're always bringing up the issues, that's never going to be worthwhile. That's never going to be something that gets executed. But if you celebrate the identification of a problem because it avoided a tragedy or even a costly accounting error, whatever it is, if you celebrate that, you shift the focus from, I don't want to be negative Ned, to like, I want to be the problem solver. I want to be the one changing things. And we see that throughout the culture shift of not wanting to be kind of the bad
Yeah.
guy. Um, how do you do that?
Change that from calling it a near miss to a good catch.
Yeah. Okay.
We go from the negative aspect to the
I love
positive
that.
aspect. So we don't document near misses. We document good catches.
I love that. That's such a subtle shift. I mean, that's a really subtle shift. Just phrasing it differently
Hmm.
is so good.
And it
And, and,
empowers
and
the person.
and part of the problem that you're kind of relating here is, do you got to make a decision. Should I go this way? Should I go this way? I'm kind of in a quandary. That's where a good risk management consultant does come in, because then it's not my decision. Call risk management. What do the
Yes.
policies say? What does this say? Because if we turn around and say, oh, no, 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 this should wait. We should cancel the surgery. Let's redo this, or whatever the situation is. Now they could just point a finger at us. So it makes it easier for them to make the proper decision, which is part of what our job is. So it's
Yes.
relating the whys, the wherefores, but also explaining to them that no, we're not going to move forward for whatever reason. And you could blame me for it. Oh, those guys are always canceling my surgeries or
Yeah.
whatever.
Well, it's interesting. I remember years ago having a conversation with a colleague about an aviation, we talked about the checklist for a pilot. We're talking about an aviation near miss or incident. Everyone was going absolutely crazy in the media about this incident. And I remember talking to the colleague and they said, well, I don't really understand the problem here because the system worked. All the redundancies that were built into the system identified that there was about to be a problem. Forget exactly what the nature of it was. They identified that there was about to be a problem. The pilots were able to divert. They talked to the ground control and they were able to land without an incident. That's a good thing. It's not a
Yeah.
bad thing that happened. The bad thing would have been if they would have ignored it and something bad would have really a big tragedy.
Exactly.
Right. It's a good catch. Yeah, it's great. So that's a great segue into risk management and risk reduction because there's a confusion there about what's what. Be your risk manager. How do facilities think about this? What's the context of daily compliance work, and how does accreditation play in between risk management and risk reduction in the facility?
Well, in daily compliance, you're doing both. For example, you might have a policy for medication labeling. That's risk management. But making sure the medication is labeled properly, used properly according to the manufacturer's IFUs, that's risk reduction. So accreditation does tie it all together because it sets clear, measurable standards for both. It forces the facility to look at their risks objectively, implement the systems to address them, and then prove they're following through. As a risk manager working with the facilities to look at their trends, even if it's something like IV infiltrates. Wow, you had a trend of IV infiltrates. Let's look at it. Did you buy a new IV catheter start kit? Oh yeah, we did. Well, maybe staff is having trouble with that, or maybe it's not to the quality that you need. These are the things that we want to address at a time when we can sit down together. Because compliance isn't just about passing this survey, it's about protecting your patients, your staff, and your reputation all the time.
So risk management and risk reduction do work together, but they're not the same thing. Risk management is the big picture. We identify areas or problems of things that could happen, assess their impact, and put the systems in place to prevent or respond to them. And risk reduction is the day-to-day execution. So it's the small, consistent things that we do to chip away at the likelihood of something going wrong. And that's the difference between risk management and risk reduction. And obviously, they both need to be incorporated into your program.
So I find that when we talk about risk, and you're in Florida, risk management is a very specific, rule and law that exists in Florida differently than it does elsewhere. But I think the concept is important. And I think the concept is a struggle for most people everywhere, because especially medical professionals, when we talk about risk management, they are thinking about IV, they're thinking about infection prevention, they're thinking about things like that. But they may not be thinking about all areas of operation. So I'm just curious, what your thoughts are on that. And I'll give a brief example, or two brief examples. One, we talk about obviously natural disasters, but community disasters. If you're in an area that's, whether it's in the US or whether it's abroad or wherever it is, if you're in an area that's prone to political upheaval, right? Like, how do you do a lock in place for that? If you're unfortunately in some of the cities or some of the places in the US, what if there's what do they call it? Active shooter scenario in your neighborhood. Do you have a lock-in place? That's not necessarily front of mind for a medical professional when they're talking about risk reduction, because they might be thinking about falls. And then the second one is operationally. I've been having a lot of conversations with people lately about, okay, well, who's your procurement person, right? Who's your purchaser? Did they change, the high-level disinfectant that they bought because they're trying to save you money, so they just bought a brand new high-level disinfectant because it was on sale and they could get it faster or whatever? Does that change your process in here? And are you unwittingly walking into a problem because some of the products and some of the equipment and supplies that you're buying have changed, and that person's not thinking, because it's not their every day-to-day function, to think about how that impacts patient care? Maybe the dry time is different. Maybe something else is different. So those two extremes, I think, are not necessarily on people's radar. And I think someone like you, Debbie, could speak to that really well, is like, really, how
We
comprehensive
deal
is
with
the
both.
kit?
We
Yeah.
deal with both. We have, our program incorporates drills, protocols, scenarios, and we've experienced it all. We've experienced the incapacitated surgeon, the one who had a kidney stone in the middle of a procedure and had to keel over. We've had the facilities that have the earthquakes. So in ways we do drills, preparation. I can tell you in California, we have our tanks double secured so that they don't fall over because they're earthquake prone. So we go over all the scenarios and drills and possibilities. Unfortunately, the active shooter has happened. And I mean, even the recent bombing in California in the fertility clinic, thankfully, nobody was hurt with that. But there are things that exist. So we do want to make sure everybody is prepared. So we do discuss those on our quarterly QA. We bring them up, and we do have all staff participate in drills to know their role, know where they meet in an emergency, know where the crash cart is, know how to evacuate in the case of a fire, making sure everybody is out for all that. Unfortunately, we have seen a lot of it. And as far as the procurement issue, that's exactly what we're seeing too, as far as people buying the cheaper IV catheters or the different solutions. And then we're also dealing with it in a way that manufacturers are discontinuing products. So other products are being bought and not being used properly. A very big example that we're seeing in the fertility world is for the ultrasound probes were cleaned with the system called a Trophon system. You can no longer get that system. So our facilities had to look into a different means. And it goes even further, because now we need to make sure that the product that they're using to clean the probe is not only safe and effective to clean for the patient, but is it going to hurt the embryo or the egg that's being retrieved? So we look at all aspects
And at a
for
lower
our
level, right?
clients.
Is that new thing, is that new agent that you're using, is it good for that probe, or now do you need to buy a new one? Right?
Exactly.
Is there a waterfall effect? I think
Right.
I always tell people they have to be creative, and there's certainly going to be contingencies that are hard to see, but like with you want to, okay, is this an evacuation type of emergency or a lock in place type of emergency? Do I have to get creative, like you said, with procurement? Drugs, I think people have seen drug shortages. What's
Yes.
the downstream effect there? How do I mitigate if I have a drug shortage and I can't
Mhm.
get this rescue agent that I would normally have? What's my alternative, right? I mean, those are all important questions.
And is there an alternative?
Yeah, right.
Yeah.
And also the whole risk management program, not to get political, but you have to look at the environment and the political landscape. We don't know if the drugs are all of a sudden going to go up 30-40% in price. We don't know. And then to your point earlier, with procurement is, oh, I'm going to save some money. I'm going to buy this instead of that. But that doesn't do the same job as that one. Or it's a 60-minute dry time,
Mhm.
and it's going to take forever. You're never going to be able to get the next case in, so on and so forth. So yeah, you have to look at all the different factors and things. One of the things that I think is really important when you're putting together the risk management program is we do look at the geographical area. We know the Midwest is prone to tornadoes. The East and the West are prone to hurricanes, flooding, things like that. So as things happen, we implement drills. We have those conversations. Offices need to have those conversations. We talk to people about if a patient's spouse walks in and they're irate,
Hmm.
what are you going to do? How are you going to deal with it? How are you going to talk to them? How are you going to calm down the situation? Because things are at a very high temperature right now. So we do have to address those things, and we do. And that just comes from, like you were saying, you got to look around. You got to think 3, 4 steps down the road. If I do, how did that just happening that I'm hearing about on the news? How could that potentially affect me? Well, you know what? I could tell you where we are in Florida. If there's a hurricane coming, you're going to have to pack up and go because the hurricanes are getting worse. So, we do address these things. We put plans in place, and we do, and we do enact them. But it's important for facilities to not think inside of their little bubble, but also to think on the outside, because those things do and will affect them.
Right. So all of that, you've talked about the cloud a few times, but all of this stuff is obviously managed a little bit easier, we think. Technology helps, right? Technology does help us in some ways leverage some of these pieces, think creatively, know what we need to be thinking about that's outside of our walls. So let's talk a little bit about technology. What role can any cloud-based platform or software play in supporting compliance, document management? And I know you have your cloud as well, so you could definitely go into that. But just even from a general, kind of a general concept, and then bring it down into the specifics.
Yeah. So basically, and it's the way that we did create our software so that it would meet the needs of different facilities. But technology is a game play. It's a game changer for compliance. If it's used the right way, a well-designed cloud-based platform does more than just store the documents. It will organize them. It tracks expiration dates. It sends reminders. It gives leadership instant visibility into the level of compliance, what needs to be done, what's not being done. That means that there's no more digging through file cabinets or chasing people for paperwork at the last minute. We understand what needs to be done, and the tracking and trending of each individual function is really important.
Yeah. It also creates accountability. So when everyone has access, real-time access to policies, credentialing files, copy reports, incident tracking, there's no excuse for things to fall through the cracks. We find credentialing a lot of times we don't get updated licenses or there's not an updated ACLS. The cloud will track that. It will give you the notifications. It will let you know when things are going to expire 30, 60, 90 days out and keep notifying you.
Yeah, one of the big things I've noticed when I've gone on survey around the world, especially with smaller and mid-sized facilities where, the staff is all also working at the hospital, sometimes those credentialing files can get a little bit lax because they say, oh, well, they do the ACLS at the hospital. Otherwise,
Mhm.
the hospital wouldn't keep them. Or they do their fire extinguisher training at the hospital. And then, well, one, you don't know if they've left the hospital since then. Sometimes you do, sometimes you don't. I mean, sometimes you don't know what's going on in other part of people's lives. And so that cloud base, as you're talking about, instead of performing sort of a credential review 3 weeks or 4 weeks before you think you're going to be surveyed, you're getting an alert in April that, Dr. Smith needs their ACLS renewed, right? And you don't
Yes.
know when that's going to happen at the hospital.
Yes, everything is present, it's current. The once things do expire, they're stored so you can see the ongoing process. You can see that the doctor's ACLS expired in March of 25, but he renewed it in February of 25. So then we can see the next one that they've kept it current.
So we happen to work with some very large facilities, multiple facilities within their organizations. Some facilities use a credentialing a platform or like the anesthesia groups. Let's take them, for instance. There's an anesthesia group we use that has 40, 50 different anesthesiologists. No anesthesiologist can just walk into a facility and start doing, anesthesia services. They have to be properly credentialed. With the right platform, you could have basically every provider pre-credentialed so that when they do come in the office, their credentials are there, they're active, you know what's happening with them. Yeah.
So in terms of, I mean, that's not just compliance, right? That's operational efficiency because now you're not wasting time when new Dr. Jones walks in and now you're trying to scramble to find the paperwork and compile the document. It's passed or it's already in the pre-screen in the library and someone just walks in, you verify, yep, that's the Dr. Jones we're talking about, and you're
Yeah.
ready to start working. So that's an
Yep.
efficiency and operational.
Right,
Absolutely.
operational
Absolutely.
and risk, because you want to make sure, we've seen issues now where people have not had appropriate licenses.
So you talk a lot about this in risk management and kind of staying daily compliant. So if you have a good sort of practice management tool where you're working about compliance, how does that help you stay proactive so that you're not cramming for the test the week before, but you're living it day to day? How does that thing become like a real tool that a leader would use?
So if I was looking for, obviously, I'm not looking for it because I've created it, but in our software, what we've created, and I'm very proud of it, is the tracking and trending. That's really the most important. So you want to be able to get notifications. You want to be able to have automated tracking alerts. If like Deb was saying, if your one little epinephrine in your crash card is going to expire, we're going to know about it. You should know about it, and you could replace it because you're going to get reminders. You want to be able to customize your forms, your logs, and your policies to meet your needs. A template is fine, but they have to be customized and made specific to the way you practice. Real-time reporting so that the leadership of the facility can go on to a cloud at any moment and click a button and see where they're compliant, where they may be deficient, and more importantly, what may be coming up in the areas that need to be addressed. Going back to where we talked about before, leadership having an active role, then I, as the surgeon or the owner of the facility, can now go to my administrator and say, hey, I noticed that the ACLS on these people needs to be renewed. Are we taking care of that? What about the crash card drugs? Now they know that I'm involved because I have the knowledge. And that's what your software should give you, is the knowledge of what is happening in your facility. Role-based access is definitely important. And of course, it needs to be secure. It needs to be HIPAA compliant. Ours is fully HIPAA compliant. You're able to store different forms, logs, things like that on there. We do review patient charts, and those are able to be uploaded. And all of that is important. That gives you the window into the world. And then when your risk manager, that's the software portion of it. Then your risk manager has to do the real-time stuff, which I'll let Deb address.
Right. And that's what we're combined. We have our wonderful software, and it's backed by some great risk managers, and we stay on top of our clients. It's really easy for somebody to say, oh, we can put these two surgeries on today, so we're not going to have our meeting. We'll push our meeting till next week, or we'll push our meeting till next month. We stay on top of the facilities to keep them compliant with QI. Hey, listen, you guys had an issue. You had a patient transferred to the hospital. We need to discuss this. Whether we get on a call after hours or what we need to do, we're going to stay on top of the client so that we ensure that not only are they providing the best patient care, but they're also taking care of their own liability. And if something needs to be reported in a timely manner, we're able to assist in doing that they enter their occurrences on the cloud, they are reviewed within 24 hours, and we can give them the advice of how it needs to be reported, who to report to, and ensure overall compliance for their safety, the patient safety, and the overall safety of the facility. The accreditation standards, anybody can read them, but do they take the time to read them and understand them? Our software implements all of the standards, and we assist the facility in complying with the implementation.
Well, that's something we always talk about in terms of like what's different about Quad A compared to some of the other organizations is that evidence of correction step in our process sets you up for long-term success because it's real easy to create a great plan of correction and then get busy and then have 10 cases and then not follow through. And a lot of what you're talking about is the follow through portion.
Yes.
And I've had people before say, well, is it easy? Is it hard? And I said, well, it's clear, it's simple, it's not easy. Easy means you don't need the discipline to follow up on it, right? It's easy to understand, as you said, you can read it. It's not complicated, but it takes the dedication and discipline to follow up day to day. And what you're talking about is a lot of the follow up. And when you guys talk about the tools and the technology, I also immediately, my brain goes to dashboards because you can get all the reminders you want and you can actually finally, follow up on it. But for a leader, it's great to be able to say, well, it's been checked off every time it needs to be checked off. But I can see from my dashboard that, our narcotics inventory was late 3 of the last 8 weeks.
Right.
What's going on there? Why are we not getting this done when it needs to get done? What about the, maybe I keep scheduling surgeries when you have your time set aside to do the narcotics inventory. Let's rethink our workflow, right? Like that is useful operationally, not just from a compliance standpoint. That's also knowing that your nurse can't get to the narcotic inventory because you're setting up a hurdle. So, you need to communicate about that.
And you're creating a liable situation.
Well, yeah, I think that's the other part, right? I think a lot of facilities are it's easy to look at compliance issue as a burden, but what is it taking away? And is it potentially being able to demonstrate to somebody somewhere, if God forbid something goes wrong, look, I've done everything possible to keep it safe and to be, crossing all my T's and dotting all my I's. And this unfortunately happened. I've done what I could to not have this adverse event or whatever it is, and it happened anyway. I wasn't negligent in any way because I can show you all the documentation.
And that's a lot of how we work with our facilities. We want to make sure we reviewed that chart, we reviewed everything, and we sit down and have a huddle. When something bad happens, such as a death, we immediately huddle. We want to make sure to see what you could do. And documentation is what they need to support themselves with.
Yeah.
And that falls back, and it's because you were so busy at the time that you're not documenting. So documentation is a big part, and that's also something we have with the cloud as well. All of the surgical forms are there, everything, and they can upload charts to our HIPAA compliant portal for us to review and do the ongoing monitoring.
I know you both know this, but I'm a lawyer by training, even though I don't practice anymore. And we all know people who get themselves into some personal situation or some environment. And I found myself more and more over the last 2 or 3 years saying, really the truth doesn't matter. What matters is the record, right? What is established in the record? Because you can have done everything really well, but if you can't demonstrate it as part of the record, no one cares, right? What does the evidence show as a lawyer, as a judge? What does the evidence show? And you could swear up and down and testify that you did everything appropriately, but if you don't have the record to back you up, it makes your case that much harder. And I think that's a message that most of us who are walking around in daily life don't realize. Like the truth is important, but only as much as the record shows the truth.
Right. And that's why we do stress documentation. And in a severe adverse event, that is something that we will sit down and do a huddle and make sure the documentation is present, is complete, and is timely because we don't want anything done late.
Yeah. Okay, so we talk about technology. So if I'm a leader of a small facility and I'm looking at technology and I'm weighing it, what what's if you're weighting features, what's the most important feature? Is it dashboards and trending? Is it reminders? Is it automations? What's like if you had to pick one feature that was the thing that you said, if it doesn't do this, don't buy it. Right? You
Tracking
have
and
all the other
trending.
bells and whistles at once, but this is the core.
Tracking and trending. I mean, that is the most important, because as Deb is saying, we need to track and trend events. That helps us anticipate if things are going to occur or not occur. There's a lot of different functions that are required, such as not functions, but like I said earlier, you need those, facility specific manuals and things like that. That's your program. But in a software, you want something that's going to track and trend all the required events and give you the feedback that you need in a timely manner.
Right. And tracking and trending it will lead to your infection control program, your safety program. It's going to address each thing because as incidents occur, it's going to ensure that all of those policies, protocols are in place and practiced.
So, you talked about pairing that with the execution part of it. And some facilities use consultants like you, some facilities use, solo practitioner consultants. Some facilities try to self-serve. What's the best way or what's the right way to like assess your need in terms of designing your approach to marrying technology and monitoring and all of those things with sort of an implementer? I get the sense that especially smaller practices, it's the 35th out of 38 duties that someone on the staff has. And that's where you can lead to sort of the back burner syndrome. Everything gets put to the back burner. How do you design your approach of your facility? And is that different for the solo versus the 20?
It's really not different, because a good consultant is going to be designed to help create efficiencies for the office. So somebody that's going to walk in and dictate, okay, you need to do this, 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 and leave you a laundry list of things. Well, that's the 39th, 40th, and 41st things that aren't going to get done, right? So a good risk manager is going to be with you when, first of all, they're going to be there when you need them, right? And they're going to work with you in getting you up to compliance. Once you're at compliance, maintaining it is a lot different than achieving it. And that's one of the big things to look for. Who is going to work with you, not who you're going to work for.
Establishing a relationship of trust is very important. We become a third arm to our facilities, so they can trust us. We don't want them to hide something under the rug. They need to come clean and own up to it so we can address it and correct it.
Make it a good catch.
Make it a good catch, exactly. And if if it was an adverse incident, whether they say, well, it wasn't because of anything I did, we understand that. But did you do everything right? And can we show that? So we need that trust level where they can sit and discuss it with us. We've held a lot of our doctors' hands over the years and are always available to. So by putting the two together really works well, that they know we're accessible, they trust us, and we become that extension of their organization. So we're not dictating what we work with them.
Yeah, well, I think that's powerful, right? Like the whole idea of reporting adverse events and accreditation, showing your works to somebody outside. The whole idea is to get better, to save yourself worse headache down the road. And I know, without naming names, that we've been through situations both, where clients that have had a bad adverse event and we've come to do investigations and things have gone off the rails there at the facility for whatever reason. And through kind of almost a team effort of providing really, really targeted assessment and you guys being able to kind of bring them back in, that facility becomes more successful and protected over time. It's not they're not like sort of excommunicated and left out in the wild. They're kind of brought back and rehabilitated is maybe a bad word, but they get to be a success story, right?
Mm-hmm.
That's what we look for.
I also think about, again, management systems and you kind of want, I heard somebody once put it as, and it's probably not a unique concept, as, you want to be doing the jobs that you have a monopoly on. And so, if your nurse director in your facility is also your risk manager, is also the person in charge of your compliance, well, now you're taking them away from patient care and being a nurse and being your nurse director. And they have a monopoly on that role. And maybe whether it's a direct hire because you have that kind of capacity, or it's a consultant, or it's a partnership, let them have a monopoly on keeping you in that, holding your hand and keeping you compliant. And that might free you up to operate at a higher efficiency in all your other areas, was kind of your point, I think, Rick.
Mm-hmm. Absolutely. And that's our job, is to guide. And that's any risk manager. Any risk manager that you hire is somebody that should be a good teacher as well. It's very important, because one of the things listen, when one of my team is in an office that you're inspecting, that they know the answer to every question, and we know every question before you're going to ask it. But that's not compliance. I need the facility, and you need the facility to understand the regulatory compliance issues and how to answer them and how to deal with them. And that's our job. That's part of our job. It's a very big part of it. So we also have to be teachers. We have to explain things. Here's the whys and the wherefores. Whether or not you agree with it, sometimes we don't. But you know what? This is the way the standards are written, and this is what we need to meet. Very simple.
So you just brought me to a big issue that comes up to me a lot. that I hope you'll expand on, and it's not obviously it's not specific to any facility in particular, but we hear it across the board, across the world is, well, we have that thing, and your surveyor asked about it. We have it. Okay. Well, was your staff able to articulate it? Well, I don't know. Well, maybe the staff said, well, Debbie wasn't here, or Rick wasn't here, or Marcia wasn't here, and they asked Carolyn. Well, but the point is, right? If you're providing patient care, Carolyn needs to know that answer probably.
Yes.
So can
So,
you
right.
expand on that so that I'm not the one doing it?
Yeah. So it's actually, I had a conversation yesterday with a new client. And what I was explaining is, and they're like, are you going to, are you going to be on site? And of course I explained to them, yes, we can be on site for you, but we're not on site to do the inspection. We're on site to be your support. So when the inspector walks in and says, I need a TTA312897, what they're really asking for is, where's your LMAs? If you just said LMAs instead of the TT12347, whatever, I'd have understood it. And that really is part of that's what we do when we're on site for an inspection. Is we just say
Right.
we're the
Exactly. We
translator,
interpret
we're
and
the
translate.
liaison. But it's really, but if I know the standards and they don't, again, we're not creating an environment of compliance.
Yes.
And that's our goal, creating that environment of compliance and making sure
Setting
that
up for
everybody
success.
understands. Exactly.
Yeah, and that's what we want all our clients to be set up for success. And to be set up for success, going right back to the beginning of this conversation, comes from leadership, teamwork, everybody understanding and buying into understanding that compliance is not a job, but a day-to-day habit. And it's for the success of the patient, the facility, and the team. Everybody comes to work for a job. You want to be able to enjoy it and feel that you're doing it well, and have respect for yourself and respect for your superiors, and also have respect for your patients, knowing them that you're giving them the best service you can.
I agree. I think that's 100% true. So as we wrap up, and this sort of sentiment of wanting people to be proud of what they do, and, final thoughts, final piece of advice is for the administrator who wants to make compliance ingrained as a natural part of the operation as opposed to a periodic event. Final thoughts, related to technology, process, anything, or completely nothing we've discussed today, but something they should follow up on. Whatever you got that you want to leave as a parting message.
Compliance needs to be part of your day to day in everything in life, just like you wear a seatbelt when driving a car. It needs to be a habit that you support and that you believe in, and understanding. So, understanding the standards, understanding the interpretive guidelines, questioning to see how you can make those standards and meet those standards in the most effective and efficient way for your facility. And that's where we come in. At Universal Healthcare, we've been doing this for 25 years now, and we've grown with the processes right along with the accreditation standards, with the events that happen. We change our policies and our protocols, and we work with the facility. I understand they're busy. They're not going to be reading the standard manual on a day-to-day basis, and that's why they have us. We're the ones that can provide that information to them and support them, educate them, and be there for them to ensure that they are meeting the standards.
A lot of times the issues come in because somebody's performing a certain function and they just don't know that it's not the best way to perform that. So that's where it's really important to be able to, and if you don't have a risk manager and a consultant that you're working with, talk to your colleagues, talk to other people, go to the meetings, talk to people. How do what's the best way to do the sterilization? How do you track infection control, whatever? Learn the better ways and incorporate that into your daily habit. It's just that simple. Every day you have great daily habits when you wake up in the morning. You've been doing it for many, many years. And if you ingrain those same habits when you walk in the door, and the first thing I'm going to do is grab the clipboard and do my logs, and then I'm going to check this, and I'm going to turn this on, turn this on, turn this on, do this, do this, do this. Now I'm prepared and ready. Do the same thing every single day. Do it the same way, and you'll be very successful in what you do. It's just understanding what needs to be done and creating those habits that will, and the protocols and the workflows that will help you achieve that. That's really the best advice I can give somebody. Besides calling us for assistance.
that touches on something I hear from our surveyors a lot. They say one of the best joys and one of the best benefits of being a surveyor is that they go into hundreds of facilities and they can pick up great ideas from other people. And I think people who don't have that opportunity because they're in private practice and they're not an inspector, and maybe they're shy or ashamed to admit they don't know something, they don't get the benefit of knowledge transfer and sharing ideas. And I think, kind of culturally, the best thing you can say is don't be afraid, kind of ask. If you don't know, ask. Or if you do know, still ask, because maybe somebody's got a better idea.
Right,
And,
because
and
change isn't always bad.
yeah, yeah, exactly. Exactly. Wonderful. So,
No, but you're
Debbie,
right. But that's actually a really big thing too, just to kind of hit on for a
yeah,
quick second. When they're looking at hiring a risk manager, a consultant, or anybody in any function, you should feel that comfort level that you're not afraid to ask this, what you perceive to be the stupid question.
yeah.
We all know there are no stupid questions. The only stupid question is the one that wasn't asked and that you should have asked, So that's really important. Make sure that there's a comfort level that you can have a conversation with them and say, but what about this? Yeah, I kind of thought that, but okay, I see what you're saying over here.
Well, I think
Very
that's
important.
as a part of human nature for high functioning people not to want to seem like they don't know. But I think if you really look at the true geniuses in the world, and there's not many of them, right? But if you look at the true geniuses, they realize that their knowledge and expertise is in a specific field, and somebody else has a tremendous amount of knowledge and expertise in the immediately adjacent field that they don't have. And so, that's not, I don't think that's a recognition of weakness. But I think mentally it's a hard concept. It's a hard pill for many of us to swallow, is to say, I may be the smartest person in the room about this one topic, but this next person is the smartest person in the room about the next topic. And it's okay to ask. And I think that's a big message that most people should take, is like, find the next smartest person in that other area.
Well, that's why successful people listen to podcasts and read books. It's not like my education stopped.
Right.
I got to keep learning.
Right. Absolutely. Well, Debbie, Rick, thank you both for joining us today and sharing real practical insights. It's clear, from talking to you, compliance isn't just about avoiding deficiencies. It's about building a culture of accountability, staying aligned with your goals and your safety goals, and using tools that make it easier and not really harder and not really a problem, from daily habits to leadership commitment, from consultants to supports to smart technology. Our discussion today really reinforces one core idea, and that's accreditation isn't a one-time deal. It should feel like your daily operation and you're part of your normal cultural and your normal habits day to day. So if you're a facility and you're wondering where to start and start with your processes, look what is happening every day in your facility, not just when a survey is coming up. Look in some random Tuesday in January. And if you need help, whether that's a guidance or tool or trusted partner, reach out to Quad A and reach out to people like Rick and Debbie. So Rick, Debbie, what's the best way for a facility to get in contact with you if they're interested in UHC services?
They can contact us at support@universalhc.com, or they can call us at 561-999-9371.
And extensions for all of us are available on the main line, so you can get to either Rick or I directly at any time, or any one of our team members. And thank you, Tom. Thank you, Quad A, for having us on the podcast. We respect and value Quad A's mission, theory, process, and accreditation standards.
Well, thank you both. Thanks again for joining. Thank you to Universal Healthcare for, I know it's you guys, but thanks to the organization for making you guys available. And thank you to anybody who's listening for tuning in. At Quad A, we're here to support this proactive approach to compliance, one that puts the patient's safety first daily and empowers your team to be successful, not just in safety, but in business and being the best practice you can be. If you have questions or feedback, we'd love to hear from you. Visit us at quada.org/contact-us. So quada.org, contact us. Be sure to follow us on LinkedIn, Facebook, Instagram, and X at Quad A Now. And you can also send us emails at info@quada.org. Don't forget to subscribe now to the podcast, Quad A Now, for more engaging conversations. There's our newsletter as well. And join us next time as we continue to explore critical roles of accreditation, innovation, and services in ensuring patient safety and improving healthcare. Until then, stay informed, stay safe, and we'll talk to you soon. Thank you.
Thank you.
That's a wrap on another enlightening episode of Quad A Now, a global accreditation podcast. Stay tuned for more captivating discussions with leaders who are shaping the landscape of quality and patient safety. Remember, patients first, always.